where are you, Jason? Where are you located?
I live in Oregon, but I am currently in Florida.
What is this podcast that you do?
The real goal is having conversations about it. All stems really from my own personal experience, a succession of family events, cancer, things like that. I was a responder at Ground Zero in New York City, but I was on site for almost 2 weeks. A lot of the people that I know that were there not only suffered physically, they suffered in other ways from just incredible amounts of toxicity and other things. But that tied in with losing my father to cancer and not having solutions, not really understanding. I took a deep dive into this entire subject to try to help. Subsequently ended up working with a group called the FLCCC as their senior website administrator for over a year during COVID. Anyway, I'm giving you a long-winded story here, but the basic of it is I keep running into these experiences where I'm faced with medical choices. I've been living in ketosis probably about a year.
Do you measure your GKI, glucose ketone index?
Absolutely. It's such a great resource.
Yeah, well, we made it for the cancer patients, but it seems like a lot of just regular people want to use it.
And I think it's an invaluable tool, at least to give you some metric of your glucose index versus your ketones. I know that everybody's different. I mean, I know there's a baseline in every body. Everyone has a heart that beats. Everyone has lungs. We have all these basic fundamentals. And I'm not a doctor. In terms of metabolism and food intake and cellular, how the cellular structure deals with all of that.
Yeah.
I have friends that can eat whatever they want and they don't gain a pound and they look just fine.
No, I know, and I see that. Dominic, Dominic D'Agostino?
I think I've come across his videos
you
online.
should have him interview. He's always in ketosis like you. He's down there in Florida, in Tampa. He's at University of South Florida. He's an interesting guy. He's all into this all the time. Very healthy guy.
I'm doing better than ever though. I mean, I was really in rough shape, and I knew I went through some detox programs as well, which actually really helped. That was really beneficial. But being in ketosis for my body.
Well, how old were you when during this? You must have been very young at the time when you were there.
21, right around there.
Yeah, that makes sense then. Okay, well, why don't you ask me the questions and I'll be happy to answer anything you have with respect to what I do.
First of all, I just want to say I really appreciate what you're doing and how I want to help forward the message any way I can. First question really would be on the protocol point. Where do you see that going? Is there any estimated timeline that you envision or loops? Is there any information on that?
We have a protocol, a comprehensive treatment protocol for glioblastoma that's currently under review by a major journal. Sometimes it can be hard to find enough reviewers. This seems to be a real problem today for many of us who work in science. It's very hard to find anybody who wants to review your papers, and that has to do with the explosion of new scientific journals putting a tremendous burden on folks that are needed to review. Consequently, a lot of faulty science, misinformation filters through because we don't have enough competent and qualified reviewers to look at things. Some journals have to really beat the bushes hard to find enough competent reviewers to make a decision on a particular submission to that journal. Our treatment protocol has over 20 authors, all involved in one way or another with trying to manage cancer as a metabolic disorder. We'll keep our fingers crossed on getting the reviews back from that submission. And if we can get it into print, then it serves as a blueprint, a framework by which any physician licensed to practice medicine, whether an oncologist or not, can participate in helping manage cancer as a metabolic disease in any patient. Your primary care physicians could certainly play an important role because a lot of this doesn't require, the kinds of things that you would normally see in an oncology ward or whatever. Repurpose drugs together with diets and synergy. And then, like you already know, measuring glucose ketone indexes, blood work, things that are indicators of whether or not therapy is having a benefit to the patient. You can outsource imaging, PET scans, CAT scans, MRIs, and if a surgical procedure is needed, then that can be outsourced to the professionals that would do that based on the information that would be collected on that individual. It's a combinatorial approach to managing cancer as a metabolic disorder, and not according to many of the current standards of care that we're currently using to treat or identify cancer in people. So this is where it's going to be, and this will be the future. It just takes a lot of time to change the paradigm by which the disorder is understood and treated.
That totally makes sense to me, and I know that it's a tremendous transition financially for a lot of the organizations and how they restructure everything around this, because the current status quo operates a specific way with specific protocols. So adding a new protocol or changing the protocol can definitely modify the financial stability, I'm sure, of some of the larger institutions.
Well, that has to be addressed, no question about it. And that could be one of the most, if not the most important obstacle to the paradigm shift to metabolic therapy. How do we shift revenue generation from one approach to another approach? So far, that has not yet been fully evaluated, and there's no desire on the part of the establishment to consider an alternative approach for managing cancer. Right now, the status quo seems to be beneficial to all participants except the patient, and that has to be recognized. And the level of knowledge and education that's associated with this has to be broadly distributed so that the change can take place. And unfortunately, that's still in its infancy.
That really makes sense. My first job was in the tech industry in 1999, and it was very interesting. And I'm tying this into what I believe is part of this scenario. I went in for an interview. It was a IT job, web design, development, programming. I was very honest, and I said, I don't have a lot of experience in this area, and I'm not a college graduate yet, but I want to be in this field. And that was the end of the interview. 2 hours later, I was hired. And I was told later the reason I was hired is because I didn't have to be remolded and rebranded and restructured in my thought processes on how to get the job done.
Mm.
And the only reason I mention that, because I think there's a lag in terms of knowledge, what's being taught in the textbook, for example, versus what's actually the next effective treatment. And there's a huge, like turning around a giant ship, I guess you could analogize it, maybe like just a giant ship turning around with paddles or something, like.
Yeah. No, there's no question about it. And when we look at the Tolstoy comment regarding something like this, it's what he said is that the most difficult subjects can be explained to the most slow-witted man if he has not formed any idea of them already. But the simplest thing cannot be made clear to the most intelligent man if he has been firmly persuaded in what he already knows, without a shadow of a doubt what is laid before him.
Wow.
And basically, it pretty much summarizes what you just said, is that you take a guy who really doesn't have a dog in the fight, but understands the problem. He's more apt to embrace something that makes sense and has potential, rather than the individual that's already locked into a standard practice that's very comfortable. There's no motivation for him to change and doesn't want to know or even understand what it would require. And this goes through humankind across time and space. And that's what we're confronted with when we view cancer as a mitochondrial metabolic disorder rather than as a genetic disorder. And that's the theory. The theory is that cancer is a mitochondrial metabolic disorder. It is not a genetic disorder. We published many, many papers on this, and people just simply don't want to hear about it. They're very comfortable in knowing that we can use all of these extremely toxic drugs and procedures and the new immunotherapies based on the genetic theory of cancer. These are not going to work for the majority of people. It's just going to prolong suffering and death. Right now, we have over 1,700 people a day dying from cancer in the United States, which is about 70 an hour. And we're not changing this at all. It's getting worse and worse every year. And the industries are making money hand over fist. Everybody seems to be happy. The federal government gives out massive hundreds of millions of dollars in grant support, hunting down genes for precision medicine, which makes no sense in light of the new understanding of what cancer is. And it clearly has not led to any major advances in improving overall survival for the majority of people. So when you look at the science tells us cancer is a mitochondrial metabolic disorder. And if one were to treat patients according to this theory, the outcome will be significantly better. Whether it leads to cures or not, we're not sure, but we certainly can be sure that the individuals who have cancer can live a lot longer with a healthier quality of life, better quality of life. Whether or not they're cured, we don't, as I said, we don't know. It would be to all of our advantages to take the next step into this zone because it's supported by what the science is telling us. Whereas the current strategies, the science tells us this is not correct. Genes are not the cause of cancer. Genes are an effect. They're an effect of the abnormal metabolism, not the cause of the dysregulated growth.
Wow,
So we're
yeah.
chasing effects. We're not dealing with the core issue of what the nature of this disease is. And that's why we have such a tragedy today, not only in the United States, but worldwide as well.
Yeah, it's really incredible. I mean, I went back and studied Warburg effect to gain a better understanding of that on that topic of, I know you discussed this. It kind of feels like the knot has finally been tied of the two technologies, the original discovery and then what you've been working on, bridged those together in terms of the discovery of the glucose, the simplicity of feeding cancer with, by glutamine and glucose, and it surviving that way, generally speaking, but then discovering by suppressing specific aspects of dietary and caloric intake, you can combat this, like the takeover of an ancient city, basically, by suppressing and then pulsing.
Yeah.
So it's just really fascinating when I think about it. And I just get so excited. I'm so excited on this call because my father went through cancer, in 2018. It was terrible. And he didn't have a solution or another option. The doctors wanted to even experiment with him. So they said, hey, we got these pills. They're $1,000 each. And he started taking them. And I swear, the degradation of his body probably 10x, 5x or 10x in terms of his capacity and strength. Total failure, not to mention $1 million plus hospital bills.
Yeah.
This just excites me in all this ways because, I'm so behind this, and I'm creating my own online resources and trying to help push forward this message because it is so important. And I'm not the person who's, protecting the body, like saying, hey, oh, don't eat what you enjoy. Don't starve you. I'm not into that. But having a solution that's available, like you said, we don't know if it's a cure. Like, is it a cure? We can't call it a cure. That's not a word that can be used in the context officially. But can it improve quality of life? Can it give that person a real fighting chance? Will it save lives? Absolutely. There's no question. That's kind of the framework I'm thinking in. And when I hear you say those things, it just really inspires me.
Well, I think it does to a lot of people who, as I said, don't have a dog in the fight, who are not coming into this process with preconceived notions about things. But for the folks that are running oncology clinics and the pharmaceutical industry building those kinds of expensive drugs and the federal government awarding grants to those to study these kinds of things, those folks are very resistant to any change. We're doing metabolic therapy to be successful requires a strong buy-in on the part of the patient. What we see is those who do the best using metabolic therapy to manage their cancer are the ones that actually play a very important role in knowing about this. They become just as much, their intensity is just as much, if not more than that of the practitioner. They know, once they understand that their discipline and collection of their own data with blood glucose, ketone measurements, and this kind of thing brings them to a better state more quickly than if they did not do that. And we see that there's some people say, oh yeah, I want to do metabolic therapy and I'll just do that part or this part. Well, that's not going to work. And then you have to have family support because sometimes doing metabolic therapy puts you in a different place than the rest of the members of the family when it comes to what you can or cannot eat and what you can or cannot do. It really is a team effort with an intense participant of the patient. This is one of the differences. In metabolic therapy, the patient plays a major role in the outcome of the disease, whereas in the current, you just sit there and you just accept whatever they give you without the knowledge of what that's doing or how it's working or why you're doing what you're doing.
Yeah.
Whereas in the other, metabolic therapy, you are an active and engaged participant in the outcome of process. It's a very different way of looking at things. And when you do metabolic therapy, you mentioned at the beginning that each person is different from any other person, or the strategy that one person may take in bringing their body back into metabolic homeostasis might be slightly different or even considerably different than what somebody else might do. We have religious and cultural differences in diets and lifestyles. These all have to be recognized and integrated into the strategy. This is very, very different from one shoe fits all size of approach that we're using today. You give a drug, it's this dosage, that concentration, take it for 6 weeks and then take something else and do this. No, this doesn't work. We don't work that way. That's why we have to know as we move the patient through from a state of unhealth to health, the blood work that accompanies these changes, the overall feelings of well-being of the patient, the contribution of the patient saying that they might do better if they pushed it this way or that way. Everything has to be modified. The ultimate goal, how we keep the patient in a state of health while we slowly degrade the tumor using natural processes, knowing the vulnerability of these cancer cells. They can't survive very long without glucose and glutamine. So the press pulse therapeutic strategy is constantly challenging these tumors cells and enhancing the health and vitality of the rest of the body. At the same time, you're slowly degrading the tumor. So it's a really interesting natural way, but it employs concepts of evolutionary biology together with the availability of drugs and procedures that we have already today. It's a combination of using the knowledge of science and the understanding of natural body physiology to go after these tumor cells, which are part of us, but just have been corrupted in their ability to get energy efficiently. So they fall back on ancient fermentation pathways with energy without oxygen, but driven by availability of the fermentable fuels in the environment. So if you take away the available fuels, these tumor cells are not adaptable. They're very restricted in the way they can function, and we just deprive them of that, and the body will take care of itself if given the opportunity. If you give the body toxic poisons and all these other things, you're actually reducing the ability of the normal cells and physiology of our body to get rid of the tumor, and oftentimes you create an environment enriching the area for the two fuels that the tumor cells need. And in the end, they win. You lose. We're trying to change the groundwork here, the framework on which we can manage cancer. It'll work. It works. It's unbelievable. Are there clinical trials? No. Why are there no clinical trials? Because no one really knows what they're doing or how to do it. You have to have trained cadre to know how to implement this. And if the medical schools are not teaching physicians that cancer is a mitochondrial metabolic disease, then they all come out and they train in procedures and strategies that are based on cancer as being a genetic disease. And the outcome is poor. We're going to remain poor with no major breakthroughs until they realize that the underlying theory on which we understand the disease is changed. How long that will be, I don't know. But the resistance to the change is unbelievable.
Working with it's a different environment and a different context, but working with the FLCC on the front line of their technology, I can tell you firsthand, it was unbelievable. Whatever we want to call it, a form of suppression from the industry in terms of even the resources that we needed to use to utilize and manage, 5 million visitors a month that we were getting. I mean, accounts being shut down because of being who the organization was. Tremendous amount of support and donations from public. Like you were saying, the person who hasn't had the formed mind but can absorb the information and learn and say, wait a minute, this is simple. This makes sense. Oh, if you have vitamin D, the body can absorb, if you start to put things together, the general consumer can start to understand these things and they go, this is really, it's okay. It's not simple in its basic scientific form per se, and the procedures and everything necessarily creating the medicine, but the application of it and understanding is like what you're saying. And what I love, it's so beautiful about this is the simplicity of it, really. And that's where this all started for me, was the complexity. Cancer is framed around such complexity, when in actuality, when we look at it from a metabolic viewpoint, we're talking about things that can be actually addressed and attacked with the right procedures. And there are repurposed drugs that are available. And I know that's true.
Yeah,
I know that's
well,
true.
the problem, of course, is many of these repurposed drugs are quite cheap and you don't make a large amount of profit on it. Like you said, with your dad giving $1,000 a pill. And this is another great tragedy that we're beginning to see, like the drug embendazole, which is a parasite medication, with nutritional ketosis, really has a powerful effect on killing tumor cells. That drug in India, because it's used for managing parasites, is very cheap. It's like 50 cents a tablet. When the cancer industry realized that embendazole had therapeutic benefits for cancer, it was up to $300-400 a tablet. We've done these kinds of things before. When we realized that something is more important than people thought it actually was, we jacked the price up so somebody can make a profit on it. But this is immoral. Unfortunately, morality is not one of the highlights of the pharmaceutical industry.
Yeah. Is the correct name for it in the industry? I believe it's one of your students. I saw him in a video, really great video. I loved listening to it. Was it biological ethics?
Yeah,
Is that
bioethics.
Bioethics.
Yeah.
And is the purpose of that specific field to really monitor this area?
Yeah, well, I think, it's to call out the problem. And no one likes to know that they're participating in an immoral act. This has negative repercussions. It's one thing to be unethical. It's another thing to be immoral. And a lot of physicians are good people, but they're operating in a lack of knowledge. So they wouldn't be considered treating patients immorally because they were never trained to know what the differences are.
Right.
But if you know that, if you understand metabolic therapy and you know that it's based on the hard science, and yet you continue to treat patients like brain radiation for brain cancer patients that frees up large amounts of glucose and glutamine, and then you give the patients steroids to stop edema, but elevating sugar at the same time, and about the treatment will cause cancer recurrence and kill the patient, and you continue to do that, then that should be medical malpractice, and it's an immoral act. And nobody likes to hear that. Of course, you make a good living. You have some degree of recognition in the society, some prestige, and that you're doing immoral acts and you're doing medical malpractice. This is not something you want to hear. Yeah. However, if you become knowledgeable about cancer, and that what you're doing now can explain in large part why very few of your patients actually survive long term, and you see it over and over again. In glioblastoma, you don't really survive much more than 2 or 3 years at the most. Maybe there goes the rare guy that makes it to 4 or 5 years. That's completely explainable by the treatment you're giving that patient. You're allowing that tumor to recur by the very treatments that you're giving them, putting you at a tremendous disadvantage for overall survival and quality of life. And then when you hear new approaches each time, clinical trial, we got a new clinical trial, yet they're doing the same thing with a slight modification over something that's already shown not to work. That's immoral. You have to call it what it is. And if the people want to live, they want to survive, they better wake up real quick and understand, because the people will be making the change, not the guys continuing to do these clinical trials on stuff that's based on an incorrect theory.
Right.
So that has to be, the people need to be awakened. This is their life, their soul, their destiny. And you're putting that precious gift that you received in the hands of people who have no clue about the biology of the disorder they're treating, which then the outcome is often disastrous.
Yeah, absolutely. I have firsthand experience with seeing that with my father particularly. On the point, and this might be a little more of a technical question, but on the radioactive point, in terms of on the biological side of that, on a cellular side, radiation treatment in the body in a state of ketosis, anything that you're aware of on a cellular level, and a biological level that's happening, and why the cells aren't as susceptible to the radiation in that state? Is there anything about that?
Well, when you, not only radiation, but a lot of the chemotherapies as well.
Yeah, Kate, I'm sorry, that was the word I was looking for, is just the chemo, not just
the yeah. Well,
chemotherapy.
in both cases, many hundreds of papers, more than 1,000. Why cancer cells are resistant to many chemicals and chemo. What's blocking immunotherapies? What's blocking radiation therapy? What's blocking chemotherapy? Why the tumor cells aren't responding as the way we would think. And it all has to come down to the two fuels that they're using to maintain viability and growth, which is the glucose and glutamine. because it turns out that the waste products of those fuels, which are lactic acid and succinic acid, acidify the microenvironment, creating a great amount of hypoxia. And that blocks a lot of the ways these anti-cancer drugs work. So it's hard to get to killing the tumor when it's dumping out a protective shield of acidity in its microenvironment. Where's the acidity coming from? The two fuels, the fermentable fuels that they take in. If you stop the fermentable fuels, you reduce the acidification in the microenvironment, now making those tumor cells more vulnerable to radiation and chemo. As a matter of fact, you can significantly reduce the concentrations of radiation and chemo because now the tumor cells are unprotected and they become extremely vulnerable to killing. I've said this, published papers on this, showed the mechanism, but nobody understands it because they think cancer is driven by genetic mutations. When you're not in the same ballpark of understanding, then you continue to do what you do and scratch your head wide and can't understand why it doesn't work. You target this gene and this and that gene and this thing and that thing and hoping to make it more vulnerable to radiation and chemo when it's the glucose and the glutamine that's making them resistant to the thing. Everything makes complete sense when you understand that the underlying problem of cancer has to be viewed as a metabolic disorder, not a genetic disorder.
Yeah.
And when you go to the National Cancer Institute website, the first thing it says, what is cancer? It's a genetic disease. It's 100 different diseases, all have it. It's not true. It's absolutely untrue. I mean, the evidence there shows we have not yet found any tumor cell that can survive and grow without those fermentable fuels. So that's the issue. It's the lack of knowledge or the resistance to the knowledge that prevents us from moving forward and managing cancer. So we know why all these things happen, why everybody's scratching their head. We're not scratching our head. We're scratching our head because we can't understand why they can't know what we know. That's the difference.
I feel like I need to send you a tuition payment for this amazing lesson you're giving me. I love the science on this, and what you're saying really resonates to me on what I've read and studied, and I'm just so fascinated with this. Like you had mentioned before, and I think there is a consensus in that comfortability, that job, that lifestyle that you're living, everything as part of it, all the many years of school you went through to become a licensed physician. There's a lot of investment you have in your future, in your life. It's a total change of
well, I still think
direction.
in practicing metabolic therapy for managing disease, whether it's cancer or type 2 diabetes, obesity, or whatever, gives the physician an opportunity to practice their art in the way it should be done, rather than being dictated by institutions that are more interested in profit than an outcome. So I think every physician who is interested in helping their patients would want to do metabolic therapy because it works and it taps into their level of experience in knowing how one person may respond versus another person. So this is really the art of practicing medicine when you do metabolic therapy. Right now, they just simply write out, many, not all, write out prescriptions and follow standards of care that don't seem, at least with respect to cancer, are not in the best interest of an outcome of the patient. Again, when the paradigm change happens, there's going to have to be a significant rearrangement in the way things are done. And I'm not against profit. People wouldn't mind paying a large amount of money if they knew what they were getting was not going to hurt them and it actually worked. We pay for things that benefit us and help us, and we don't mind sometimes doing it. But when you pay enormous amounts of dollars, tens of thousands of dollars for a miserable existence and a truncated lifespan, that's immoral.
Yeah. You know, and there seems to be, and it's also a public perception too, because I can tell you, even from my dad's experience, he was completely sold on the chemotherapy. He was completely sold on everything. It all sounded, it was the mainstream, the correct decision. It was what all the big books said. And he's one of millions who have been through
well,
this.
you know, it's a very believable system when you go to some of these oncology centers. I mean, the buildings are beautiful. Everybody is dressed nicely. They speak appropriately. It's very impressive when you go to these places. And these guys must know what they're doing because they look good. They speak clearly. They're very comforting in what they say. Yet we have 1,700 people a day dying from this disease, 70 an hour. So there's some gap here. There's something wrong with this picture.
Yeah, it's definitely a problem. Big problem. Yeah. I mean, this is because I feel like right now what's happening with what you're doing and the message that you have and the discoveries that you're communicating about that are historical discoveries brought to the present with what your own research and others present day research bringing to the forefront really an evolution of how cancer is handled. And like I know it ties into diabetes, it ties into heart disease, it ties into obesity. It ties into all types of other things that the body goes through under various types of duress, pain, if you will, of, you know, the things that we put our bodies through.
Yeah. No,
So it's real, I feel like this is the beginning of something really big.
well, the other thing too is the other thing you have to realize is that the cancer industry, there's many private foundations like Susan Komen Breast Cancer, and it becomes spread through the society that pink ribbons and, you know, Lung Cancer Awareness Month and Breast Cancer Awareness Month and all these things, and it rallies people to feel that if they participate in a running, swimming, biking event to raise money, that they're doing something good, and that's an exploitation of the human spirit to help others, because that money that they raise is going nowhere except to perpetuate the status quo.
Yeah.
And that's another immoral act. And because when you look at the scientific advisory boards of the foundations that you're running for or supporting, most of them think cancer is a genetic disease, meaning that the money you're raising is to perpetuate the status quo. And I think if people knew that, they'd stop doing all that crazy stuff, because they're actually contributing to the problem, not resolving the problem.
Right.
They're exploiting the good nature. They're exploiting the humanitarian nature of humans to do good for others. And that's not what's happening in these private foundations. Every one of them thinks cancer is a genetic disease, and that perpetuates the same suffering and death that we're already seeing.
Wow. That totally makes sense to me. And I can definitely resonates with me and my view on it as well. I think we're coming upon, I mean, with the proliferation of data today and after COVID and after everything that's happened in the medical world, post-COVID things coming out now that were realized that were mistakes and confessions of errors in medical decisions that were the status quo are now surfacing in different ways. You know, not a lot of them, but there have been a few interesting ones that came out. I think there was another person you were speaking to on an interview that mentioned something about, you know, retired medical doctors that are out of the industry, they're out of the field, but they've always had their basic code in place, which was, you know, do no harm, basically try to help somebody. That may be the first people to really enter upon this and be able to actually administer metabolic therapy in some way, shape, or form without the concern of having their license taken away, you know, because they're already retired or something. You know what I mean? There's all these.
Well, you'd like that to happen to the young people, have the young people do it, because they're going to be the ones that are going to make the change. The retired guys are, you know, they're retired. I mean, but they couldn't say anything when they were in the system. They start to speak only after they leave the system. So, because you don't want to jeopardize your livelihood. But the problem is, you know, first do no harm. If you consider that the poisonous stuff that you're doing to patients is helping them versus doing nothing, then you can rationalize giving people poison to help them, because the poison itself will allow them to live a little bit longer. So you rationalize the harm that you're doing to the person by considering that that possibly this treatment will allow them to survive a little bit longer on the planet. When you realize you can allow them to live far longer without the toxicity if you did metabolic therapy, you can't do it because the system says you can't do it. The standard of care locks the physicians into procedures that are, if you go outside the recommendations, you could in fact jeopardize your license, because they say, well, there's no scientific evidence to support metabolic therapy as a legitimate way to manage cancer. But the scientific evidence is there. They just have not been exposed to it or been trained to use it. And that's another thing. You know, it's just the system is so strong and so strongly supported by the academic industry, the hospital industry, and the pharmaceutical industry. You're talking about an enormously powerful that is not to considerations other than what has been done, despite the fact that it doesn't work for the majority of people. And those folks that do survive, by the grace of God, often suffer lifelong ailments as the result of surviving toxic poisons and radiation. They suffer enormously from all these adverse effects as the result of their surviving. This is another problem that you see. We have millions of cancer survivors, but they've all paid, most of them have paid a significant price. But in the end, they will not live as long as most of those folks that were not poisoned and irradiated. We want cancer patients to survive long. We don't, when we say cure, we have no clue whether metabolic therapy will cure anybody. But if people did metabolic therapy and they lived into their 90s and died from something other than cancer, I would consider that a tremendous success. We won't know that if we're not allowed to do it, if the system does not allow that to happen. And what we find is that we're starting to make cracks in the sense that some physicians will integrate metabolic therapy in with standards of care, current standards of care. And we're starting to see better outcomes with that. What has not yet happened is the replacement of standard of care with metabolic therapy. In other words, metabolic therapy as its own strategy, and then bringing in other parts of therapy that are part of current standards of care, but using them strategically as potential therapies that could finish off a small group of surviving tumor cells in a more logical way, rather than using them as upfront procedures that often weaken the body and allow the tumor cells to survive. And that's why we developed the press pulse metabolic strategy, which can integrate metabolic therapy with standards of care, but done in the right and correct way. And that has to be recognized. So we think there's probably going to be some sort of a hybrid system initially where we don't throw out everything that we've developed over the years. And then gradually practicing physicians will come to know what seems to be the best way to manage cancer, the best strategies that take advantage of all the available tools that we have.
Yeah. Wow. The license point, I know that it's so touchy for anyone in the medical field. I mean, you jeopardize anything out of the status quo. You jeopardize your license, your ability to make income, your ability to support your family. I mean, it's this whole, it affects everything. But like you had mentioned, it's true. The pharmaceutical industry, the medical industry, the schools, they are all tied together inadvertently because they all feed each other in a different way at the basic form: jobs for the future and keeping a current system and structure, in place. If the school books say it's true, that's generally what the consumer believes.
Yeah, well, but I think that the cancer patient, the person, the people in the streets, like you say at the beginning, the guy who really doesn't have the dog in the fight, but just understands the concepts, they have to be the ones to make the change. They are the consumers. They are the recipients of what's being delivered.
Yeah.
If the patients say, I want metabolic therapy. I want you to find a way to give me metabolic therapy the way we have outlined it. There has to be some change because they are the consumers. There will eventually be people trained who know how to do metabolic therapy and do it in a way that does not jeopardize their license to practice medicine. And
Right.
people are going to flood by the thousands to these folks because they know they don't want to be, many people fear the treatments as much as they fear the disease. It's, oh, you're diagnosed with cancer. Oh my God, I'm going to die. But how am I going to die? Am I going to die from the disease or am I going to die from your treatments?
Right.
And about 50% of people are killed by the treatments themselves.
Yeah.
Rather than the cancer. I mean, no matter what way you look, it's the emotional shock of this, because people know that cancer is killing so many people. And a lot of times we overdiagnose people and we start treating them for things that sometimes we make a bad situation worse, busting in there and doing things when we didn't have to do that at the beginning. We know how to shrink and manage these cancers. Then that would be step one, never mind, ripping into them with biopsies and procedures and things that could actually make this a bad situation worse, much worse.
Right.
Or
Right.
a controllable situation, uncontrollable.
Wow.
So we really need to know how to do this. That's what our treatment protocol stresses. If we can get that out and published, it serves as a handbook, a guide for the medical profession to know how to deal with this. Now, it was for glioblastoma, which is a deadly brain cancer, but you can tweak it for all cancer. That's another thing that people have a difficulty understanding. We have not yet found any tumor, no matter where it goes, that can survive without glucose and glutamine.
Wow.
So brain cancer, colon cancer, breast cancer, this stuff about, we have a treatment for your specific cancer. The only thing that would be is metabolic therapy.
Right.
It's just amazing. And then you hear these advertisements on news at night about Opdivo and Keytruda, all these immunotherapies, and they spend more time telling you how that drug is going to kill you than how it's going to help you. I mean, this is nuts. This is crazy, right? I mean, think about it. And people sit there and look and they say, oh, this must be the best. And they have hyperprogressive disease where the drug will causes the cancer to grow twice as fast.
Oh,
You know, and then sometimes it'll attack your liver and kidneys, your lungs before it kills the cancer cells. So it's just crazy because the theory under which this stuff is based is incorrect. It's incorrect, and then it can explain everything. Majority
wow.
of stuff can be explained by the incorrect theory of how we're treating the disease. It's a tragedy. It's an unbelievable tragedy.
Wow. And on the protocol itself, that's not something that's publicly available in the present time. It's only released to the journal at the present.
Yes, only released to the journal at the present. So once it would be accepted, then we can make it public, and then any physician could look at what is being proposed and could do it. There's
Okay.
nothing really specialized that you have to have some special training. We think almost any person given a license to practice medicine could implement the majority of what's going on
Right.
in that protocol. And
Right. Because mm. I'm sorry, go ahead.
the patients will have a much better chance of survival.
That totally makes sense. And I mean, just again, from a layperson who's not a trained medical doctor myself, I can see it as, if we look at it from the viewpoint of a baseline of the patient, their body, their blood, you know, whatever they've got going metabolism wise, deficiencies, overages, whatever there might be going on, all that can be determined. And then that press pulse comes in with particularly, I mean, I think the largest focus has probably always been on the glutamine, obviously, because that's something the body needs naturally in sufficient quantity to actually maintain itself. But the whole pulse part of it totally makes sense. And you're giving the body vitamins, you're making sure you're supplementing in various ways. It all adds up.
Yeah. You just have to know, well, that's the cutting edge. That's where we are right now, is trying to develop the best dosage, timing, and scheduling for the glutamine targeting part of the procedure. And
Right.
you can't get funding for that because it's not sexy science. It's the stuff that's actually going to make the difference in the clinic. And that's why our research is supported in large part by philanthropy and private foundations. People want to just give us money because we know we're right. Once we figure out the dosage, timing, and scheduling and lay it all out, then you're going to have the clear strategy of how to manage cancer without toxicity. And it'll work. And it's from what we've seen so far, and we haven't perfected the procedures at all. The results are really quite remarkable for those that really want to understand and embrace the procedures and the ideas. We always find it amazing when they go back to their attending physicians and they say, "My God, this is unbelievable. They're always miffed at what they see." And what's really surprising to us is so many of them never ask, what did you do? How can you explain this? They all just say, "I don't know what you did, but just keep on doing it," without even asking, like, what is going on here? There's no sense of inquiry. Like,
Right.
if you see something you haven't seen in a long time, don't you think you'd want to know what the hell went on? Yeah, I'm taking away the two fuels that are driving the damn cells so they can't grow.
Right.
Oh,
Like
I didn't know
a
that.
cancer
And
remission,
then,
you're telling the doctor the cancer keeps shrinking and they're going, scratching their head.
well,
You think they
because
want to get in on the party.
they don't know, but they don't see it in most of the patients who subscribe only to the standard of care. And then when a lot of cancer patients tell me their oncologist said food and diet has nothing to do with cancer and glucose means nothing. Cancer can't live without glucose. Glucose is an essential fuel for driving the dysregulated growth of those cells. And
Wow.
so many oncologists never heard of that. How could they go through an oncology training program and not know what's driving the dysregulated growth of the cells? They just want to know how to incinerate or poison them. They don't know. They can't grow without the fuel, without energy. Without energy, nothing can grow. What's
Right.
giving these cells the energy to grow? Fermentation. What's the fermentation fuel? Glucose. Is there another one? Yes, amino acid fermentation involving glutamine. So it's all there in the scientific literature. It's just that these poor folks have never been trained to know this, and that's the tragedy. So they go to medical school and they learn cancer is a genetic disease. They have no clue about the metabolism of what's driving the dysregulated growth. So the medical school curricula has to be dramatically changed over time.
Yeah.
And who writes the curricula to the medical schools? The pharmaceutical industry plays a big role.
Yeah.
So that ain't going to happen anytime soon. So the textbooks, the NIH, they're all, it's not that they're bad people, but they're not willing to engage in alternative considerations as to the nature of what's going on.
Right.
So any event, so the people, it comes down to the people. You want change, people better understand what I'm saying and go out and make those changes. Because I'm doing everything I can. I'm publishing the damn papers, open access. Anybody can read Press Pulse Metabolic Therapy. Just put my name in, just put Press Pulse on Google, and you'll get the paper.
Yeah.
And you can read it. And you
Yeah.
can look at the paper and try to, and if you can't understand it, have someone to explain it to you. So, and then when someone explains it to you, you're going to walk away and say, this makes perfect sense. Let me run down to my oncologist and see if he does it. He says, no, there's no evidence, no clinical trials, no evidence
Right.
to support that. So you're caught in this vortex of no movement.
Yeah.
So, and then everybody's like shocked. Whoa, man, how come this guy doesn't know what's going on? Yeah, that's the problem.
Before I forget, what are the names of the organizations that people can donate to?
Most of my donations come through Travis Christofferson's Foundation for Metabolic Cancer
Okay.
Therapy, and also through the university, Boston College. People can donate to the Biology Department Cancer Fund research, which is my stuff. I can't accept money from anybody. If I do, I have to turn it into the university or deposit it with Travis Christofferson's foundation.
Gotcha.
My contract at the university prevents me from accepting any funds for what I do. So it has to come through legitimate sources to run our research program. And that's where the funding, the more money we get for our research program, the faster we can develop dosage timing and scheduling for metabolic therapy, which eventually will be the standard of care. The faster we get it done, the faster it gets into the clinics.
Totally makes sense. I live my life this way. I do videos about that and talk about it, and not even as advice, but more my experience of ketosis and what it's like for me going through it, and that it's not for everybody necessarily. And I have to eat certain foods to maintain a specific GKI. It's very exact for who I am.
Well, I think that's exactly what the cancer patient will have to do as well. The problem is, though, one of the things is that when you are treated with radiation and chemo, it makes it hard to get into the GKI, the therapeutic GKIs. Your bodies are put into tremendous stress, and stress elevates glucocorticoid hormones, which elevate glucose.
Right.
So the very treatments that you're receiving are actually preventing metabolic therapy from doing its maximum managing cancer.
Wow.
So again, you have to know all this. It's the physiological state of your existence of your body, and how you have to play all of the sources off each other. So you don't want to compromise any part of your body's healing abilities, and that's what metabolic therapy is. It exploits the natural ability of your body. It gives your body an opportunity to take care of the problem while you are slowly degrading it non-toxically.
Yeah.
That requires an absolute effort on the part of the patient, knowing what to do and how to do it, along with the advice of the attending physician.
Yeah, I'm so inspired. Can't wait to make my next videos. Just talking to people that are starting to experience this lifestyle.
Why don't you interview an oncologist and see what, and you get slapped down. And everything I'm saying, you're going to find out is not consistent with what the worldview is.
Well,
that'll be a real eye opener.
I would love
be a real
interview.
eye opener for you.
Sat next to my dad, listening to the oncologist tell him he needs his next treatment in order to have a fighting chance. Yet every time the next treatment happened, I noticed things seemed to get worse. Firsthand experience observing that, I know that we have a very broken medical system. There's so much work to do, but I think tackling cancer is probably one of the most difficult areas. And like you said, it's such a active participation of the individual. And this is something that I talk about a lot separately to those that follow some of my content, is in relation to the addiction of glucose, the addiction of food. Yeah. Every happy life experience that I have since childhood involved hot dogs and hamburgers and Doritos, Taco Bell.
I know, it's terrible. But it's a tough one, and I'm not belittling that. I'm not dismissing that at all. That's why we need motivation and participation on the part of the patient. And sometimes they say, the hell with it. I'm going for the chemo and radiation. I can't do this metabolic stuff. So
I
that's at least it's their choice. They're making
yeah,
a conscious choice. That's okay. I'm not telling people don't do radiation and chemo. I'm just telling people that there's an alternative to doing that if they so desire to do it. And they have
yeah,
the ability to be engage in it, but
yeah.
I'm not telling anybody don't do standard of care. I don't see people lining up in front of Dana-Farber or MD Anderson waiting anxiously to get their next dose of poison and radiation.
Yeah, no, I mean, it is crazy, and yeah, it's crazy to think about. But on the basic fundamental of not having the option is even part of the bigger problem here is
Yeah.
that, oh, you have the option to try these experimental horse pills, and I say horse pills as in the pills my dad were taking were about 2 inches long. I don't know what they were. They were incredibly massive. You have that option,
Yeah.
$1,000 a pop. You can't go, hey, we have this metabolic approach that's in trials
Or you
right
can
now.
have a water-only fasting for 3 or 4 days involving distilled water or something. It's not in the same ball.
Yeah. No, but that's the problem though, is the addiction. The food addiction is so strong. I mean, I
know.
used to live off Taco Bell. I mean, this was my lifestyle. I smoked for 10 years.
Yeah. Oh no, listen, I think that's more the norm rather than the exception.
Oh, but it's such an addiction where the body genetically is, and I've heard you mention this in your videos, but it's so true. I mean, you're like salivating from thinking about driving by a McDonald's sign or a Taco Bell sign.
Yeah, well,
your
actually,
body's actually responding.
When you eat carbs, your insulin goes up into your cells, and we evolved to need it's the tasty, it's the delicious, to get the sugar. And as soon as that hits your lips, insulin goes up and gets the glucose into your muscles and other organs. But we have books here in physiology where a person would walk into a room and just look at the donut on the table, and you can measure the insulin going up in his blood in anticipation for eating the donut, but without ever eating the donut, just looking at it. The visual sight and smell of the donut causes your insulin to go up in anticipation that, why would you not want to bite the donut after our physiology is telling us to eat the donut?
And so I can understand it from a physiological, historical view, because it, like, I've seen you, and I mean, you mentioned this in videos, but it totally resonates with me as well. And in life, we were fighting for food. We were constantly in struggle for the next meal.
Yeah, well, that's true. And the cancer cell is absolutely dependent on that sugar. So if any cell in your body is getting excited about the donut, it's certainly the cancer cell.
That makes a great photo, a great logo or a picture. The cancer cell with the donut.
Oh yeah. I mean, you're just feeding it. We've done some studies. We show that the level of blood sugar in the body is, for cancer patients, directly related to how fast the cancer grows. And it's been repeated over and over in all the major cancers. So we know. And then you go to the oncologist and they have candy and donuts in the waiting room for you.
Yep. Yeah. No, I know. They give you those sugar drinks. They got those chocolate milk.
I mean, nothing makes no sense, right? It's absolutely insanity. It's insanity.
I'm glad I could laugh about it, though. I'm glad I can laugh about this, because it really is, it's something that really needs to be addressed, and so much needs to be done. And I look forward to the future of this. I really care about choices.
Okay, so your mission here is just to spread this word to the people that need to know it. And
I want to spread the word, but I also want to give hope that you can get in ketosis if you had to. If you needed to as part of a therapy, as a doctor recommendation, and you needed to get into a state of the body, it is possible. And I can tell you, it is the hardest thing I've ever. That's why, when I say an addiction, I was addicted to cigarettes. I know what it's like to be addicted to nicotine and feel like I need my next smoke. I know that feeling my entire life of glucose addiction, and kicking that out the door. There's nothing has been harder. It is absolutely.
Well, that's why you have to realize to do metabolic therapy for cancer management does require self-discipline, and which could be in short supply in our society today. So, but that's, if you want to live, this is what you might have to it's the choice, live or die. And
Yeah,
I had some people tell me they would rather die from cancer than give up Snickers bars. So
I can
that's a
understand.
personal choice. That's a personal choice, but I think most people want to live, and they're willing to bite the bullet on some of these things to know that it will help them.
Yeah.
But that's the word is. It was nice speaking with you, Jason, and I hope this information will impact the lives of some people and make them start to think a little bit more about the key issues associated with cancer.
Well, I really appreciate you putting time in this. It was a real pleasure, and I learned so much. So thank you.
Oh, thank you. And nice speaking with you now. Take
You
it
as
easy.
well. You as
Bye.
well. All right.
Bye.
Bye-bye.